The gastroscopy was inserted there. Mum took control of the feeds really for the very first time and went a little bit overboard actually. I had to have words at this point, and subsequently he's back down on the 50th centile. Okay. So another problem that I encounter very frequently as a paediatric neurologist is seizures. And the mitochondrial clinic is no exception to that. I've already said that the brain is very frequently involved in mitochondrial disease, particularly in children. And the first thing we need to do with seizures is to establish a diagnosis. And I've just been teaching medical students this afternoon about the sort of different problems that might present and might look like seizures and how we make that diagnosis. And one of the key elements in that is an EEG. And this is a young boy with the EEG electrodes applied to his head, sitting there quietly, idyllically. They don't all behave like this in the EEG department, believe you me. And Roger will back me up on that, I'm sure. Medical treatments that we use are anticonvulsant drugs, in particular Tegretol, which many of you will be on. We do advise, particularly in very young children, that an anticonvulsant called Epilin is avoided, as that has been associated with the deterioration of the condition. Information like that has only really become available to us through seeing lots of patients and through having specialised clinics. But we have recognised now that things like Epilin treatment can cause sometimes very severe problems indeed. And the use of rescue medication, things to give if a seizure is going on longer than one expected. We give advice about reducing the risk not only of seizures occurring by having good sleep hygiene, treating fevers in children quickly, but also about putting oneself at risk. So not doing dangerous activities that aren't supervised, and dangerous activities might be having a bath rather than a shower, because if you have a seizure in the bath, there is the risk of that becoming very complicated indeed. Now, I did mention earlier that development and learning difficulties can be major problems in children with mitochondrial disease. And that is indeed true, and in fact is sometimes the thing that brings children to my attention. That's because some children with mitochondrial disease have gone through a period of initially very normal development and have then had an illness that has set them back, and they've lost some of those skills that they've already acquired. So they've been walking, they get an illness, and sometimes they lose that ability to walk, only to regain it many months later. In assessing the degree of developmental delay, we need to assess whether that's a specific delay with specific problems. So is it a problem just with mobility, or is it a more global problem that also affects the language and how children learn to speak and how they understand language as it's spoken to them? And other factors involved in that are assessing whether they're hearing properly. If you cannot hear properly, you cannot learn to pronounce the sounds properly, and you will seem to not understand what is said to you. Again, this is another area where there's a multidisciplinary team approach, and one that I'm very familiar with in paediatric neurology, as these conditions affect children outside of mitochondrial disease as well. But a key area, and a key area in my practice in general, is making sure that children achieve what they can to the best of their abilities, and maximising their potential development. And important in that is education. And the delivery, we've already heard today, physiotherapy services are very good for children. And part of that is that a lot of those physiotherapy services and occupational therapy and speech and language therapy are delivered in a school setting. So getting the education right, getting a statement of special educational needs, if necessary attending a special school or going to mainstream school with support from a special educational needs assessment is vital in my view. Now, I spend a lot of my time in clinic providing genetic counselling of the risk of mutations being inherited by children. And for a lot of patients that we see in the mitochondrial clinic here, it's discussing this mitochondrial DNA and its inheritance. But increasingly, as I said, we're recognising these nuclear genetic defects and the impact that they have on children. And we can indeed look for a number of these antenatal. I put this slide up as well because in relation to what I've been saying previously about developmental delay in children with seizures and involvement with the brain, looking after children with mitochondrial disease can be very difficult at times. It can be very time-consuming. There are very difficult emotional issues to deal with in looking after these children. And I think respite itself is something that we very much, both Professor Turnbull and myself, advocate for parents and indeed for carers of adult patients. These can be difficult diseases to look after. And I think that respite care is a vital necessity. Now, this is going to be a rather complicated slide to show, but I just wanted to emphasise essentially what all of this day is about. This event is about you, the mitochondrial patient, and perhaps initially clinicians, but also the other sorts of advice and services that are available to you and are centred around you as mitochondrial patients or children who have mitochondrial disease. And behind all of those services is a whole other layer of services that all relate to how they can be best providing that service to you. And indeed, outside of that again, are other factors. If we just follow that up, making a diagnosis involves a clinical assessment, taking tissue in the forms of muscle biopsy, analysing DNA. What do we do with that tissue? Well, we look at it biochemically, we look at it histochemically. Some of the clinical investigations that some of you will have undergone will be EMG or EEG, performed by Dr. Whitaker over there, or an MRI scan. And that's the sort of level of support that feeds right through all of these branches. And finally, I'm going to finish with a couple of plugs. You've already heard about my mitochondrial cohort study. As I've tried to emphasise going through this talk, it is extremely important to us to try and get as much information about you without inconveniencing you, but to try and get as much information as we can about you and the problems that you encounter and that your children encounter, so that we can begin to really understand these diseases. At the moment, I think we're making inroads, but we're scratching the surface of what we could potentially do, both in terms of understanding them and also in terms of providing support. Sorry. We're here at the moment. We've got about 350 patients altogether. We want to be back up here. We want, by the end of the 3-year recruiting period, to be up here with about 1,500 patients. And then we have a volume of information with which we can really do some good research.